nurses were not getting the support and attention that they should be getting. They're the backbone of the American healthcare system, and certainly underappreciated by the public.
The survival rates have markedly increased, which means we're bringing many more injured, some of them very seriously injured, soldiers, sailors, airmen, and Marine back to the States that we never would have in previous conflicts.
There are 3 million nurses in the country working in all kinds of settings, but there are 2 million veterans in California alone. So we have a tremendous amount of work to do very quickly to get all of the nurses across the country, and for your purposes, those in California, to learn as much as possible about veterans' health care.
Starting at ground zero, educating people, this is what this means. This is how we deliver health care within the DoD, VA, and even civilian care, so that you can help reduce some of these negative outcomes like suicide, chronic medical and mental health issues.
What we have are generations in transition. We have generations of veterans in transition. And whether it's transitioning from deployment to home, from military to civilian, older veterans are transitioning from work to retirement.
75,000 students who would like to be nurses, especially in the past few years when jobs were tight, applied to nursing schools throughout the country and were turned away.
And the reason that Mr. and Mrs. Jonas are so key to the answer here is that they're willing to dedicate their own personal money to make this happen by educating the next generation of nurse researchers, educators, and clinicians.
And who better to identify a problem either in a social relationship or in an occupational relationship or just by the symptoms that other people may not recognize. Nursing is wonderful. We've always been forged from adversity.
Nurses are, again, sort of the backbone of the healthcare system. And if you're raising the awareness and education of nursing, then that's going to improve the health of every patient, every family, communities, and our whole country.